Success of the rollout may be down to greedy capitalism, but it's working out quite well, isn't it?
Well, I think that's an odious remark from the Prime Minister, and it tells you everything you need to know about the priorities of him and his government. They are more interested in serving the interests of corporate capitalism and wealthy oligarchs than they are in serving the interests of the British public. And being a member of Parliament, being a minister, being a prime minister is an absolute privilege. And the absolute priority must and should be to serve the interests of the public. And it's obvious from these remarks, he's let the cat out of the bag. I think we kind of knew it anyway, really, but it's significant, I think, that he's on the record now as actually making it clear where the Prime Minister and where this government's priorities really lie.
Some would say the very development of the COVID vaccine is a success of capitalism. Private medical companies working together, a healthy degree of competition, and everyone benefiting.
Well, I mean, it's clear that the rollout is going well. It's about the only aspect of the COVID crisis that has worked out well. But it's made it possible for the pharmaceutical companies to make an absolute killing out of this. I mean, they're making huge profits. And we know that this government's priorities is to use public services as a cash cow for the private sector, and very clearly now from what the Prime Minister has said. But no, he doesn't rely on capitalism and greed. I mean, look at Cuba. Cuba's been subject to a US blockade for almost 60 years now. And yet they've developed their own COVID vaccine based on the needs of people, based on humanity, rather than private greed. And I think that's a model that we should be seeking to copy, rather than actually this rather grotesque remark from the Prime Minister that, this is all about greed and capitalism. I think nothing could be further from the truth.
Chris, a public inquiry into the COVID response will surely come up in the committee proceedings. Surely now is not the time to think about such an inquiry?
Well, I think the government has failed the British people. I think that the death rate in Britain is amongst the highest anywhere in the world. And look, we are the fifth biggest economy on the globe. And yet we have a situation where people are dying needlessly. And the kind of reckless way in which the Prime Minister and the government handle this, particularly in the early days, discharging elderly patients into residential care homes in the full knowledge that this was a very dangerous ploy. We heard at the earlier part as well about herd immunity and, we're going to lose a lot of loved ones before their time, said the Prime Minister. And it seems, they weren't really interested in actually doing what they should have done. And this is a problem, I think, with a laissez-faire approach to the economy, to the delivery of services. When your priority is about serving the interests of corporate capitalism rather than the people, and you sort of stand back and you don't intervene as governments should, particularly in an emergency like this, you end up in that situation where people needlessly die. And of course, let's also remember, many people, many millions of people are really struggling now financially as a consequence of the policies that this government has adopted in relation to COVID. Yes, they've extended the furlough scheme, but they need to do far more. There's many people as well who've fallen through the gaps. So they've not covered themselves in glory at all. And as I've said, I think the Prime Minister's latest outburst is just further proof, really, that this government isn't fit for purpose.
You mentioned a number of issues, the economy, delivery services, also the care home issue. If you were there, the liaison committee today, what would you ask the Prime Minister then?
Well, first of all, I think we'd want an apology for his absolutely grotesque comments about corporate greed and capitalism being the drivers to actually delivered the COVID vaccine. But I think we'd also be wanting to get some answers about how it is that they've issued contracts to their friends, how it is that the Secretary of State for Health was ruled to have acted unlawfully in the way in which he's handed out contracts, how it is that we've spent so much money on test and trace and on PPE, which has, been woefully inadequate. What an absolute waste of public money. And what is it going to do, frankly, to actually rein this back in? And is it not time to recognise that it's important, particularly in an emergency like we're facing right now, in a pandemic, for an interventionist government. And look around the world, look at examples around the world where governments have been more interventionist. They've been able to deal with the problem much more effectively. They've had very, very few deaths as a consequence of COVID, and some seem to be completely clear. Look at New Zealand, a great example of the way in which an interventionist government can actually make a real difference and do what they are supposed to do what it should say on the tin, to actually serve the people, not to serve the interests of their friends, not to serve the interests of corporate capitalism, but to actually serve the interests of the people that elect you. That's what a democracy is supposed to be about.